Okay, guys, so last time we were discussing blood. We have talked about your red blood cells. We have talked about how you make hemoglobin, how they carry oxygen and carbon dioxide. We also talked about the plasma layer, which is the most superficial layer of your blood, and it contains proteins and a lot of water that basically helps your blood having its fluid characteristics. Now we are going to move on to discussing your blood in terms of production and destruction. One of the first things you need to understand about your blood is that your red blood cells lack one of the main structures that make a cell. Actually, they lack multiple structures. And that's basically your nucleus and all of your organelles. So when you look at your typical cell, a typical cell will contain nucleus, endoplasmic reticulum, rough ER or a smooth ER. It will contain your lot of ribosomes, a lot of lysosome, Golgi, and etc. But when you compare that to your red blood cells, almost all of these components are missing. Now, the reason all of these components are missing is because they are removed after the cell has matured, so you can open up room for hemoglobin. So basically, you empty the inside of your cell so you can pack that 250 million hemoglobin into your red blood cell and basically maximize the capacity of your red blood cells to carry oxygen. So when you look at a typical lifespan of a red blood cell, it's about 120 days. So 100 to 120 days is a typical lifespan of a red blood cell. Now, the reason the lifespan is short is because if a cell is damaged, if your red blood cell is damaged, there is literally no nucleus or organelle that allows it to make proteins and therefore fix its problem or fix itself. So basically, it's a one-time use. You produce a red blood cell, you use it for about 100 to 120 days, and then you basically destroy it. So keeping that in mind, we require to continuously produce red blood cells. So in average, if you're comparing the numbers, you're producing about 2 million red blood cells per second. And at the same time, you will be destroying about 2 million red blood cells per second. And that basically keeps your blood level at a consistent number. So destruction of 2 million and production of 2 million. Now, what we're going to look at right here is take a look at what is the process of producing your red blood cells. Now, I'm not going to go into detail about this. It's a little bit beyond the scope of this class, but I do want to kind of go over some of the essential components. First thing first, when you're thinking about red blood cell production, it requires an input of a hormone called erythropoietin. Erythropoietin, erythro means red, poietin is coming from the word production. So basically, this is a hormone that is going to help you produce your red blood cells. Now, what is the organ that actually produces this hormone? That would be your kidney. So erythropoietin or EPO is mainly produced by your kidney. Liver also produces it, but again, the majority of the EPO comes from your kidney. Now, this EPO, this hormone, is going to literally travel through your blood and go to your red bone marrow. This should sound familiar. Red bone marrow was the location where you would see your bone marrow, basically your red blood cells being produced or your total blood cells being produced. So when EPO reaches your red bone marrow, it allows the stimulation or production of your red blood cells. So keep in mind that because you're continuously producing red blood cells, you must have EPO in your bloodstream. So there's a constant level of EPO in your bloodstream. So if somebody has a kidney disease or kidney failure, there is a good possibility that the EPO level will drop. And as a result, these individuals may end up with low red blood cell count or medical condition we simply call anemia. Now let's take a look at the condition where you have low levels of oxygen in your blood. So first thing I want you guys to look at is the word hypoxia. Again, break down the words for yourself. Hypo basically means below, and oxia implies oxygen. So hypoxia putting together implies you have low levels of oxygen. So here is a scenario. You start with a low blood level, low oxygen level in your bloodstream. Now, as this blood is circulating to your body, including your kidney notices that the level of oxygen is low, and therefore increases the production of the erythropoietin or EPO. Do keep in mind, you always again produce the EPO. All you're doing now is you're increasing the level of that production. So again, this EPO is going to target your red bone marrow, and therefore that's going to increase your red blood cell production. Now think about this logically. The more red blood cell you have, the higher the capacity of the oxygen, or I should say oxygen capacity carrying of that red blood cells. Therefore, your level of oxygen can go back to normal. Now here's a really cool fact. So you may have heard of this before. We're gonna bring this concept to people who will be training in high altitude to get themselves kind of an advantage. So when you go to high altitudes, kind of think about it. When you go to higher altitudes, what happens to the level of oxygen? If your answer is the level of oxygen drops, then you are correct. Kind of think about people who may climb really tall mountains, like Everest, right? These individuals always carry oxygen tanks with them because there is so little oxygen as you go up in the elevation. So when you go up the elevation and you start to train, whatever training you do, that training that you're doing, basically resistance training or endurance training that you do, forces your body to produce more red blood cells, right? So there's an increase in EPO, there is an increase in red blood cell production, and therefore increase in the amount of oxygen your body can carry. So why does that matter? Why is that important? Why do I need the oxygen? Oxygen goes to my cell and it helps me produce energy for my cells in the form of ATP. So basically, if I have more oxygen in my bloodstream, I have a higher capacity to produce energy. What does an athlete need? Lots and lots of energy. So if you think about this, take this athlete that has been trained in high altitude and now bring them back to the normal environment where they will be basically competing. So compared to their other people that are basically competing, or your competitors, you have a higher level of red blood cells in your blood, which means more oxygen, which means you have a higher endurance compared to your competitors. And then as a result, you can basically last longer, right? So if you guys are familiar with the cyclist Lance Armstrong, one of the main ways that he would train himself would be basically go to mountains and train. And again, because that helped him basically increase his EPO and increase his red blood cells. Now here's the thing. Does all athletes actually do that? No, sometimes they do a shortcut, and that shortcut is basically getting an injection of the hormone EPO. So you basically reach the same result, but without actually going to the altitude. So this is a form of doping, actually. It is dangerous because if you imagine, if you have more red blood cells in your bloodstream, that means your blood is thicker, basically makes you more susceptible to heart attack and stroke. So now that we have talked about red blood cells and our capacity to change the level of RBC production by fluctuating the levels of our EPO, we're gonna basically switch sides and look at the process of destroying your red blood cells. So kind of a reminder again, every second of your day, in average, you're destroying 2 million red blood cells for every 2 million red blood cells you're producing. And again, that is helping you leave or keep your red blood cell count constant in your bloodstream. So when I think about destruction of your red blood cells, you need to think about that red blood cells are basically packed with 250 million hemoglobin. So when I'm destroying a red blood cells, what I'm actually destroying is not the red blood cell itself, because that's just a shell. I will actually be destroying the hemoglobin that is inside my red blood cells. So those 250 million hemoglobins that I have. So how do you destroy that? So if you look at the structure of the hemoglobin, and I don't know if any of you guys remember this, this is from our previous lecture. Kind of drawing a very simple drawing of that. We did kind of a 4 components, and these 4 components are called your globin. There are 2 alpha, 2 beta. At the center of each of them, there was another component which was called your heme, right? And that was the color component. And at the center, you had your iron, right? Fe. Sorry, my thing is not working very well. And Fe was basically, or iron is basically what carries or binds to oxygen and carries the oxygen. So what happens to each of these components of hemoglobin as you start to destroy your hemoglobin? So the globin portion, which is the largest of the circles that I draw, that's basically protein. Now we know proteins are made up of amino acids. Now kind of think about it. The protein that's inside of you comes from the food that you consume, right? Now let it be meat or legumes, beans, whatever the source of protein was that brought it in, right? Now I don't want to just get rid of that protein just because I'm destroying my hemoglobin. So what you do actually is you take your protein, you break it down to individual units of amino acids, and then use that amino acid to synthesize new proteins. So basically what you're doing is you're recycling your protein component. Now the second component you have is the heme component. Remember, heme is the part that is basically making your red blood cells red. So heme actually undergoes a process. It is considered a waste product, so we do get rid of it. But before we get rid of it, it actually changes multiple times and eventually ends up as a molecule called bilirubin. Now, bilirubin has a yellowish tinge to it. Bilirubin eventually goes to your liver. From your liver, it transports into your digestive system and eventually removed as part of the fecal matters. So part of what we identify as feces, or the color of the feces, comes from bilirubin. You also can partially associate the color, the yellow color of urine, to the removal of bilirubin through your urinary system. The last component we had is iron. So iron is basically also an extremely essential component. Remember that if you're destroying 2 million red blood cells and releasing this iron, you still need to be producing and replacing those 2 million red blood cells. So iron is another component that's basically going to be recycled. So typically that iron from the destroyed red blood cells recycle back to your red bone marrow and can be used for production of new red blood cells. And however, if you do have extra iron in your body, then that gets stored inside your liver for later use. So among the 3 components that makes your hemoglobin, the only component that is removed continuously is the heme component. Now let's learn a couple of cool facts about this. Before I do that, this is the same concept we just talked about. I just do a flow chart for you, but it's literally identical to what I just talked about. So one of the disorders you see in people who may have liver disease is a condition called jaundice. Now, jaundice is not an actual disease. It is more of a condition that highlights a possible damage to your liver. So that bilirubin that I was talking about, which is the basically when heme is destroyed, it gets converted to bilirubin and goes to your liver. So the job of your liver is to basically get rid of this bilirubin and get it out of your body. But if the person has some sort of liver disease, there is a really good possibility that liver will not be able to accomplish its function. Therefore, the bilirubin will remain inside the body, right? And because of its yellow color, it's going to change the skin color or skin to that kind of yellowish tinge. And it's also visible in the white of your eye. So if you have a darker skin, this might not be very visible in that person. So for that individual, you would basically be looking at the white of their eyes. And it's one of the easiest way to identify if the person possibly has some sort of liver disorder, like cirrhosis of liver or hepatitis. Now, you probably have all bruised yourself at some point, and you have noticed the color changing that basically underways after you have a bruise. So you start with this kind of really dark red purplish color, and eventually it will kind of get that yellow tinge to it and eventually remove. So the reason you go through that color change is basically at the beginning, you have destroyed red blood cells in that region, and you have that tinge of red or dark red color or bluish color associated with red blood cells. And then eventually, as the body starts to process that, it starts to break down the hemoglobin in these red blood cells and create bilirubin. And as a result, the coloring of the bruise actually changes to kind of, again, changing to that bilirubin eventually. So when you see your bruise kind of have that yellowish tinge to it, that marks almost the complete healing of your tissue. So typically, a bruising can completely be removed for about 4 weeks if it's really severe, but typically in about 2 weeks you will have your bruise. If it's not, again, it's more superficial, it should be healed about 2 weeks. So up to this point, we have talked about production and destruction of red blood cells. Now let's take a look at some of the medical conditions associated with an imbalance in those numbers. So what I would be focusing here is an imbalance in terms of decrease or drop in the amount of red blood cells that you have. So basically more destruction compared to production, or there is basically an imbalance which causes your red blood cell count to go down. So as I mentioned earlier, this condition is known as anemia. So anemia is, simply put, low count of RBCs. Here are some of the common symptoms that will help a medical profession identify your condition. Pale skin. So that's kind of logical. The less blood you have circulating in your skin, the lighter or paler the color of your skin will be. You will feel fatigued. Kind of, again, think about it. If you don't have enough oxygen, that means you cannot produce enough energy or ATP, and therefore your body is lacking the energy requirement, hence you would feel always tired or fatigued. Short of breath. Again, you don't have the capacity to carry oxygen, so you're always trying to bring in more oxygen. Chilled. It's a really cool fact. So majority of the heat that you associate with your core temperature comes from your metabolism, which is basically production of ATP. So a byproduct of producing energy is literally heat production. So if we already have low amount of energy being produced, that means the byproduct level also drops, which means the byproduct being heat, your heat level is dropping, and that causes your core temperature to drop. And that causes the person to continuously feel chilled. Now, there are variations of anemia. One of the main ones that are unfortunately more visible among African Americans is sickle cell anemia. So here is your donut-shaped typical cell that you will see in a healthy individual. And this is a sickle-shaped cell that basically has that kind of crescent moon shape to it. The reason you have this, it's not listed here, but if you are interested, it comes from the mutation or a change in the protein beta globin in your hemoglobin. and that causes a change in the shape of your red blood cell. Now, because these red blood cells are not shaped normally, they are more susceptible to destruction. So they are basically more susceptible to hemolysis. Again, if this sounds unfamiliar to you, break down the word for yourself. Heme means your red color or red blood cells. Lysis means destruction. So that basically what I'm saying is hemolysis means destruction of red blood cells. Now, the crescent shape of your red blood cells also make them less flexible, so they can cause blockage of the blood vessels. So it can actually cause pain in the joints where there is kind of a curvature into your blood vessels. And the best treatment as of right now is to receive a continuous blood transfusion for these individuals to replace the number of cells that are hemolyzed as a result of sickle cell anemia. Another scenario that I've already mentioned previously is associated with kidney disease. Now, if you're unfamiliar, the word renal means kidney. So renal anemia means when you have a problem with kidney, and as a result, your kidney fails to produce enough erythropoietin or EPO hormone. If your EPO level drops, the production of red blood cells drops, and therefore you end up with anemia. If an individual is identified as carrying or having a condition, renal anemia, the best way to treat it is receiving an injection of EPO. Most people who are doing dialysis, as in they're connecting to the machine because their kidney are failing, their blood cell count needs to be continuously monitored to make sure that they are also not dealing with anemia. In many cases, they may end up having the condition. Blood loss is kind of a common sense. If you lose a significant amount of blood as a result of accident or trauma or hemorrhage, that causes your red blood cell count to drop. Best treatment, again, receiving blood transfusion. So if you do have blood loss, at the beginning, again, if they're starting the procedure on you, they may just give you water to increase your total blood volume, but eventually you need to survive, you need a blood transfusion to replace the loss of red blood cells. Last type of anemia I want to talk about is iron deficiency anemia. So think about if you want to make hemoglobin, at the center of your hemoglobin molecule, you have 4 iron atoms. So if you are low in iron, you basically will not be able to make hemoglobin, and therefore you will be unable to make your red blood cells. So sorry about that, guys. There's a helicopter climbing over my house right now. So when you think about your iron deficiency anemia, basically your iron level is low, and that causes your inability to produce the proper amount of red blood cells. This is really common in women that are pregnant because their body basically is going to be responsible for their own red blood cell production as well as the fetal red blood cell production. So typically, they don't consume enough to have that. Now, most of the time, if you are identified as a person with iron deficiency anemia, they tell you to increase your iron intake. Typically, you get a supplement of iron to go, and basically you take 1 pill a day. In many people, this causes severe constipation because it pulls water out of your digestive system. So a lot of time they tell you to also consume a higher amount of red meat. Red meat is basically packed with iron. You also can consume vegetables like a spinach that is also high in iron. But typically, if you are really low or deficient in iron, the best way is to take an iron pill on a daily basis until your level goes back to normal. Now, the last part of your lecture, we're going to be focusing on the Puffy Coat. So Puffy Coat is basically the smallest layer, typically less than 1% of your total blood volume. Puffy coat is made up of your white blood cells and platelets. If you recall, this is a layer that sits between your plasma and your red blood cells. So it's kind of in between the two layers. Now, the white blood cells, or WBCs, are also known as your leukocytes. So that's another name for them. The main function of your leukocytes is to defend your body against infective agents. And we already talked about this early on when we were looking at the functions of the blood. So white blood cells, there are different types or categories of them, and I'll briefly go over them with you, but there's not much information I'm gonna get into for your class. Platelets, on the other hand, are essential for blood clotting. So basically, if you have some sort of hemorrhage or bleeding or cut, one of the essential components that helps you survive that bleeding is platelets. Please do keep in mind, guys, that platelets are going to be combine or work very closely with a plasma protein called fibrinogen, which we mentioned earlier. It's about 4% of your plasma proteins. These two must be present at the same time and at the right concentration to effectively stop a bleeding. Now, let's go ahead and talk about your white blood cells. So there are 5 different types of white blood cells. Now, they are listed here for you. They are called neutrophils, lymphocytes, monocytes, eosinophils, and basophils. You can, just by looking at the numbers I have, you can see that the frequency of these white blood cells significantly varies. So you go from 50 to 70% to as low as less than 1%. Now, each of these categories of white blood cells have a very specific function inside our body. So briefly looking at some of these functions, neutrophils are responsible for eating up or phagocytosing pathogens or infecting agents or cellular debris. So simply put, they're going to eat up any foreign material and chop it to little pieces. Eosinophils, which is one of the least common type of white blood cells we have, are extremely important for reducing an inflammatory response. So this is really important in terms of basically dealing with an allergic reaction. So they're the ones that kind of silence an allergic reaction. They're also extremely important in fighting off parasites. So if somebody has a parasite in their digestive system, one way to basically identify that is by doing a white blood cell count, or what we identify as differential white blood cell count, and look at the frequency of eosinophils. If there is a spike in the number or percentage of eosinophils in your total white blood cells, more than 4% basically, that means that person, there's a really good chance that person is dealing with some sort of digestive parasite. Basophils is another category. These are the least common. So if you even look at 100 white blood cells, you may not actually even see one of these. These are the ones that are actually trigger an inflammatory response in your body. So if you have basically an allergic reaction, these are the cells that initiate that process. You also have cells called lymphocytes. Please make a note for yourself. You guys are going to see this more when we talk about lymphatic system. Lymphocytes, there are 2 types of lymphocytes called B cells and T cells. Majority of what we identify as our immune response, either initial or secondary immune response, are coming from these lymphocytes. So lymphocytes are extremely essential for creating an effective immune response in a long term and short term against infective agents. And lastly, you have monocytes. Monocytes are also extremely important. These are one of the first ones that go into the site and try to fight off an infection. And their job, monocytes, their job is very similar to neutrophils, as in they will go to the site of infection and bring in the pathogen and chop it to little pieces. So other than the functions that I've described for you in terms of the responsibility of each of these white blood cells, I do want you guys to remember the percentages in terms of frequency. I don't want you to remember them in terms of numbers, but what is the most and what is the least common. So basically remember the order. So one way that I tell my students to remember, we have an acronym for it, basically, never let monkey eat banana. If that helps you guys remember the order of the frequency from the most common to the least common. So never let monkey eat banana tells you the most frequent to the least frequent. And again, in addition, you do need to know basic functions associated with these 5 categories. One last thing before I move on to the next topic is that please do note when you look at the pictures of these 5 categories of white blood cells, they are significantly different, and that's what gives you the capacity to differentiate the 5 categories of white blood cells. So if you ever have done differential white blood cell counts when you go to the doctor, which is kind of typical if they're trying to diagnose you, this is basically what they're looking at, identifying a different type of white blood cells by just looking at their characteristics. Now we're gonna end our lecture by looking at platelets. Platelets are going to be, again, cell fragments, and they're not actually full cells. Another way for us to call them is thrombocytes. If you kind of compare the sizes, these pink dots you see are your red blood cells, and these smaller fragments between them are your platelets. The most important job, as I mentioned, is formation of blood clots with the help of a protein in your plasma called fibrinogen. Briefly, a couple of words that you might hear in terms of disorders of white blood cells and your platelets for white blood cells is leukemia, which is basically a form of cancer associated with white blood cells. And there is quite a few different types of leukemia, unfortunately, that could be associated typically with your lymphocytes. And then the main disorder in terms of platelets would be thrombocytopenia, which is when you have really low concentration of platelets in your blood, and that makes you more susceptible to bleeding because, again, you cannot effectively form blood clots after a hemorrhage. Now, there is a blood typing slides. There's a few slides on blood typing. I will not discuss this in terms of your lecture. This would be an actual lab for you. So you are not responsible for the next few slides in your PowerPoint for the lecture portion of the class. I will have a full lecture on that for the lab portion of the class. Okay, so that's it. Our next lecture for you guys to focus on would be your cardiovascular system as we start to go over the heart anatomy and the physiology of the heart.